Hi everyone, today we'll be talking about testosterone tests, different types of tests, normal range, and tips to maintain healthy testosterone levels. Testosterone is a hormone produced by the testicles in men, and in smaller amounts by women's ovaries. It is responsible for the development of male sexual characteristics, muscle mass, and bone density. A testosterone test is a simple blood test that measures the amount of testosterone in the blood. It's used to diagnose conditions related to low testosterone levels, such as hypogonadism or infertility. There are two main types of testosterone tests: total testosterone and free testosterone. Total testosterone measures the total amount of testosterone in the blood, while free testosterone measures the amount of testosterone that is available to be used by the body. The normal range for testosterone levels varies by age, but in general, for adult men, it's considered normal to have levels between 300 and 1000 nanograms per deciliter. For women, the normal range is 15 to 70 nanograms per deciliter. However, it's important to note that these ranges can vary from laboratory to laboratory. So, how can you maintain healthy testosterone levels? Here are some tips. 1. Exercise regularly. Regular physical activity can help increase testosterone levels. 2. Maintain a healthy diet. Eating a balanced diet that is high in protein, healthy fats, and low in sugar can help maintain healthy testosterone levels. 3. Get enough sleep. Lack of sleep can lower testosterone levels, so aim for 7 to 8 hours of sleep each night. 4. Manage stress. Stress can lower testosterone levels, so finding ways to manage stress through meditation, yoga, or other techniques can help maintain healthy levels. 5. Avoid steroids and other performance-enhancing drugs. These substances can disrupt the body's natural testosterone levels. In the next video, we will discuss some foods that may help to boost testosterone levels. Thanks for watching and stay healthy. Like and subscribe for more health-related videos.